Hi everyone, I'm Dr. Sang-Dong Lee, Busan National University Children's Hospital, South Korea. It's a great honor to introduce our study to Korean Journal of Urology and the corresponding author of this study. I would like to introduce brief background of our study. Vesicoureteral reflux is present in about 1% of normal healthy children and in 30 to 50% of children with symptomatic urinary tract infections. Recently, endoscopic treatment of vesicoureteral reflux has gained widespread popularity and has become an alternative to ureteral implantation. Although ureteral implantation has a success rate in the range of 97 to 99%, relatively few complications, and minimal mobility, it cannot compete with the advantage of endoscopic treatment, which leaves no scars, is fast to perform, and causes no or minimal pain. However, recent studies have reported a success rate of up to 94% of after a single injection and up to 98% after twice injections. Besides this high success rate, very low complication rate have been reported about 1% of patients. Ureteral obstruction is one of potential complications after the endoscopic treatment of vesicoureteral reflux. Several studies reported that the overall incidence of ureteral obstruction has been estimated to be 0.7 to 5.7%. Well, let me introduce Dr. Chung, who is first author of this study. He will present more of this study. Please, Dr. Chung.
Thank you, Dr. Lee. I'd like to present about our study. In this study, we evaluate the incidence, risk factors, management, and outcome of postoperative ureteral obstruction after the endoscopic treatment for VUR. 90 patients were retrospectively reviewed and classified two groups according to ureteral obstruction. Ureteral obstruction group was consist of 7 cases, 10 ureters, and non-obstruction group was consist of 83 cases, 122 ureters. The diagnosis of ureteral obstruction was based on the finding of significant hydronephrosis by ultrasound during follow-up. This is our routine follow-up plan. We analyzed the age, sex, injection material, laterality, voiding dysfunction, constipation, lunar scar, preoperative and postoperative findings of ultrasound, endoscopic findings, and injection number and volume. Additionally, we reviewed the clinical symptom and sign, natural course, management, and outcome of ureteral obstruction after the endoscopic treatment. In our results, the incidence of ureteral obstruction after the endoscopic treatment was 7.6%. In preoperative clinical characteristics of patients, there were no significant risk factors between two groups. In surgical findings of patients, there were also no significant risk factors between two groups. In obstruction group, 3 patients did not show any symptoms or sign after the onset of ureteral obstruction. Most of your patients with ureteral obstruction experienced spontaneous resolution within 1 month with conservative therapy. However, 2 patients needed temporary ureteral stents to release the ureteral obstruction. In our study, the incidence of ureteral obstruction was a little higher than in previous reports. There were no predictive risk factors for developing ureteral obstruction after the endoscopic treatment. Although most of ureteral obstruction spontaneously resolved within 1 month, some cases required drainage to relieve symptoms or to preserve lunar function.
Thank you. Well done, Dr. Chung. The important point of our study was that standardized follow-up examination would have to monitor the success of the performed procedure and facilitate an earlier diagnosis of developing ureteral obstruction. Thank you for your attention.